Outbreak, the National Department of Health has called for calm as the cases of hand, foot and mouth disease increase in some parts of KwaZulu-Natal. As of yesterday, 195 cases were recorded in the KZN province, with 89 of the cases recorded at Lenham Primary School in Phoenix. So the disease is a fairly common viral infection, which mainly affects infants and children under the age of 5. So to give us an update, we are joined virtually by Doctor Vuyiswa Kumalo, Medical Officer from the National Institute for Communicable Diseases Outbreak Response Unit. Dr. Vuyiswa, good morning, and thank you for making time to chat with us here this morning.
Good morning, and thank you for having me.
Perhaps you could give us an overview of the numbers as it stands, given what is on record. And then in the same breath, when we're looking at why hand, foot and mouth outbreak mostly affects infants and children under the age of 5, unpack that further for us, please.
Okay, thank you. So as you mentioned, the latest numbers that we do have coming out of KZN do state 195 cases, I believe. And as you mentioned, the majority are from Lenham School in Phoenix. Hand, foot, and mouth disease is a very common viral infection. It circulates globally in our country as well, and mainly affects children under the age of 10. The majority of those children would be under the age of 5. It's because these children's immune systems have not developed yet, so the virus has an easy entry point.
All right. Thank you for painting that succinct picture, because we're looking at some of the common symptoms that are displayed by hand, foot and mouth disease. I mean, we've seen it's fever, there's sore throat, tiredness and loss of appetite amongst other indicators. There's also small blisters on the inside of the mouth and the sides of the tongue as well. But perhaps you could just speak to, whether it actually also presents with serious public health threats as we speak.
All right, so as it is a mild disease which is self-limiting, this means that it would resolve by itself without any particular medical intervention. Usually within 7 to 10 days, the disease does not pose a serious public health threat. The transmission is quite easy as it's highly infectious, so direct person-to-person contact, if someone coughs or sneezes, and then those viral droplets come into someone's mouth or nose from the hands. We know we do touch our faces a lot with our hands, so we have to make sure we're always washing them. Otherwise, we're giving the virus a chance to enter our bodies.
Because parents and caregivers are now urged to keep their symptomatic children at home until they recover to prevent further spread of the disease. Perhaps you could talk more about when, symptoms then usually start after transmission. How long do they also take to clear?
All right, so when you would be exposed to someone that has the disease, it would take about 3 to 6 days from that time you were exposed to develop the symptoms. So by the time the children are showing symptoms, they've already been infected at least 3 days prior to that. And then over the next 7 to 10 days, the disease then clears. The children should no longer be having any symptoms. If the symptoms are actually persisting beyond this time period of 10 days, then I would advise the parents to consult a healthcare provider.
Dr. Kumalo, what does a typical treatment regimen look like for these children?
All right, so as hand, foot, and mouth disease is a mild disease with no specific medication targeted toward the virus, what the doctors or the nurses would be treating are the symptoms that the children would present with. So if they're presenting with fever or sore throat, general body aches and pains, treatment would be directed towards those specific symptoms.
Okay, so we're also trying to dispel and sift through some of the misperceptions, but also just understand a little bit more. What's the connection between hand, foot, and mouth disease and then foot and mouth disease?
All right, yes, that is quite a common misconception. It is quite confusing, in fact.
Yeah.
The only similarities would be in the naming. So in humans, we get hand, foot, and mouth disease. In animals, mainly livestock, such as sheep or cattle, that's where you get the foot and mouth disease. Completely two different diseases affecting two very different groups. Hand, foot, and mouth disease is the human disease, whereas foot and mouth is limited to the livestock.
Because, so you mentioned earlier on it is a mild, disease, and I know there have been questions about whether schools need to be closed. There's also been questions about what support is on offer from the department, from the NCID as well. Talk to us about, those endeavors underway.
All right. Well, the NICD is giving support to the KZN Department of Health while they are conducting their outbreak-related surveillance. So we're providing some technical guidance. We did host an information session last week with the province that was attended by the schools that were affected. The principals attended that, and that was an information sharing session where we partnered with the province to allay the concerns and fears of the schools, the principals, as well as the caregivers.
Okay, that is key, and thank you for that correction, the NICD. We also then obviously looking at allaying fears about how it may spread to other parts of the provinces in the rest of the country. Talk to us about what's been done on that front to contain it to KwaZulu-Natal, and if it does spread, what are some of those measures in place to assist the other provinces at hand?
Okay, so the best way to contain the spread of this disease is through basic hygiene practices. So number one would be washing your hands, ensuring that there's adequate soap and water for the children in the schools to be able to wash their hands before they eat, after eating, after playing. Also making sure that surfaces are disinfected. So high-touch surfaces such as taps, doorknobs, if there are toys, if it's happening at a daycare center, all those would need to be disinfected to prevent the spread of the disease to other parts of the province. So we need good hand washing.
In terms of protocol for the students or for the learners that, are infected, talk to us about what the procedures are that the parents need to undergo, perhaps to alert the NICD, to alert government, to alert the school. What is the best practice at this point?
So if a parent notices that their child has fever, sore throat, loss of appetite, and those small blisters on the palms of their hands or soles of their feet or around the mouth, firstly, they will alert the school. The Department of Basic Education in KZN is working hand in hand with the KZN Department of Health to get all the numbers of affected learners. So they would report to the school would then report to the province, and the province would then reach out to the NICD if they need additional support.
All right. And then just as we wrap up there, you're obviously the expert, and we were looking to you for some advice. As we round off, what's some of those tips and tricks that you have for parents, caregivers, and learners and teachers alike to manage this as we navigate from here on to?
All right. So as I mentioned, the best way to stop the spread of this disease is through hand washing. Soap and water, minimum 20 seconds of hand washing. Ensure that when you're coughing or sneezing, you don't cough or sneeze into your hands, rather into a folded elbow. If you do know that your child is sick, at that point, the child would then need to be taken out of school. But if your child is healthy and well, they may stay in school. The main thing is to wash our hands.
Okay, hygiene, and wash our hands. Dr. Vuyiswa, thank you for your time at this hour. Again, Medical Officer Doctor Vuyiswa Kumalo joining us from the National Institute for Communicable Diseases. He's a medical officer there, just chatting about the outbreak, the response from the outbreak response unit, of course, what the update is regarding hand, foot and mouth disease in some parts of KwaZulu-Natal. Laying fears about whether it's spread or not, and really what parents can do at large to assist their children who have been infected, and perhaps also how to better maintain hygiene and clean hands. Again, thank you to her for joining us.